Hello everyone, welcome to the part 3 orientation session. First of all, huge congratulations for completing the most daunting task of MRCOG, that is MRCOG part 2. That is the most frightening one and you all could do it. That's a very, very good thing. And now we can just move on to the part 3, which is much more easier as compared to part 2. Yes, I don't say that it's a cakewalk, but yes, still it is much, much, much better than the part 2 exam. So hello, yes, good. Good evening, good Rashim, Dr. Shweta, yes, Dr. Khan, good evening. Good evening. So good to have all of you here. Okay, so what do you know about part 3? Right? What is your thought process about part 3? What are you planning about part 3? How many of you are planning for November? Who is planning for May? We'll be talking about all these things, but I would like to know what are your thoughts? Yes. November, yes, good. Anybody would like to unmute and speak? May. Okay. November. Good. Good evening, ma'am. November. Yes, very good. November. Oh my God. Good, good. Okay. So very good. It's we are going to talk about I'm going to take this hot topic that May versus November. And after that, yes, we'll be talking about what is the exam syllabus, how the pattern is, and how I can make it less scary. So Bam went through the first video, but it's really scary. No, it's not scary. It's not scary, and I'll just let you know how I will make it easy for you. So let's start. Start today's session. So crack MRCG part 3 in 90 days. You have 90 days, right? You have August, September, and October. So we are going to talk about 90 days and how we are going to utilize our 3R strategy to actually cover up this. Okay, so that's what we are going to talk about now. So first, I will start with a beautiful video from Dr. Lavanya, one of our alumni, when she attended the convocation ceremony, because you are now just one step for the convocation. So I think you should start developing that kind of a feel that you are in the convocation. And let me tell you, this is one of the best convocation ceremonies which RCOG organizes. So do go and attend it live when you get the chance. And of course, you are just very close to it. So I think you can just get this celebration vibe before I take you dive deep into the academics part. I think let me share the computer sound. Yes.
At RCOG London, UK, to take the prestigious certificate MRCOG. I recently cleared MRCOG in November. I'm very much thankful to Almighty, my family, my husband, and my dear mentor, Dr. Bhawna ma'am. I really appreciate her help, and her courses were very apt and useful. The Part 2 MRCOG course definitely needs extensive preparation, while the Part 3 needs a focused preparation. I'm really thankful to Dr. Bhawna ma'am for mentoring me and helping me to achieve my dream. Thank you.
So you can see the smile. The smile itself shows how you feel when you go to the convocation ceremony. It's one of the grand ceremony, and I think you should all keep that dream in front of you so that you are quickly motivated to complete this exam and then achieve this grand degree very soon. So we are going to talk about part 3 for what is part 3 about, what is the format, and November 25 versus May 26, understanding marks allocation, and then how we are going to prepare. What is the 3R fast track strategy, which we are going to use for 90 days, and we are going to work on it. This is something to motivate you because she prepared in 6 weeks, right? She prepared in 6 weeks. So this is for you all. Cheers.
Hello, this is Yasmin Al Khatib. I'm an OB/GYN from Jordan. 2 days ago, we had our part 3 results, and Alhamdulillah, I passed with 74%. And although I studied for only 6 weeks, so my journey started with Dr. Bhawna from part 2. I can say she is the best mentor ever. She is very smart. The way she simplifies things, her calmness, her patience, her dedication. You can rely only on her study materials, and you'll pass with high scores with shorter study time. When she says you'll succeed with 70% less study time, believe her. I have colleagues who have enrolled with other MRCOG courses, and we were comparing our study schedules and study materials. Believe me, Dr. Bahawna is the best. She knows on what you have to focus in your studies and what not. She's highly organized and highly focused, and she's there for you 24/7. One other thing I would like to say is that she will be there with you till you pass, so you don't have to pay every time for a new registration. That, for me, that reflects how genuine she is. So I highly recommend her, and I don't know how to thank you, Dr. Bahawna, for everything. You are truly the best. Thank you very much.
So what I want to say is that if somebody can prepare in six, this I have many more examples like this, but I don't want to like put up all those here. But this gives you an inspiration that if it can be done in 6 weeks, it definitely can be done in 3 months, right? So that is the
Hello.
point which I was actually trying to bring up here. So what about November versus May? I'm going to give you the advantages and the disadvantages, and you will pick up the right answer for you. In part three, there is a very important concept of shared decision making, right? So in part three, when you tell something to the patient, like what are the options for that patient? Like a patient with a fibroid comes to you, you can give her the options of medical management, you can give her the option of surgical management. So now in this case, you don't tell the patient that, okay, you go and have the surgery. There is a concept known as shared decision making. So you and the patient together will make a decision. So what is your role is to give the adequate information to the patient so that the patient can take the decision appropriately. So this same thing I'm going to do here, November versus May exam. I'm going to give you the enough information and then you can pick up the right moment for you. And of course, if you have already had a decision in your mind, I would like you to stick to it, right? Because you are the best judge for that, and it is very much doable in 3 months. The question is not about whether it is not doable in November. It is very well doable for the November exam. It is only because many of the students texted me that, like, whether they should go for November, May, which is correct. So that is why I'm bringing up this discussion here. But if you are already clear about when you are going to appear, it's perfectly fine. Now, reason to choose the November is fresh momentum. You are already into a very much extensive study. You have gone through all that curriculum. The concepts are fresh. Guidelines are not going to change that much in next 3 months. Maybe one or two guidelines may come up new, but still lot 95%, 99% it's going to be the same. 90 days is enough. Yes, definitely, it is enough. With the structured roadmap, passing is very much achievable. And I can give you n number of examples, the students who have done this already. Early completion, become MRCOG certified earlier, open career opportunities. So you always have been dreaming for it. So why not? Why not do it now? Why postpone it till next May? It's a long, long time. Stronger recall you can build up on clinical practice and guideline knowledge from your part 2 prep. So because you already have the knowledge, so you now can add the things whatever you want, the kind of communication or the kind of presentation which is needed for the party that can be added on it. So the biggest advantage is that you have your study material quite ready with you. The knowledge is quite fresh, and now you can just apply that into your part 3 exams. So this is the biggest advantage if you take your exam in November 2025. Now, what is the advantage of choosing the May exam? May exam, more preparation time, right? You have more preparation time if you have heavy clinical duties or you have any kind of family commitments, then you have a 6+ months of breathing space. Confidence building, particularly for those who feel that they are not good in communicating with the English and they may want to spend some time practicing for the language, not on the part three. They want to spend some time to practice the language skills, right? So, in that case, it could be a communication building exercise, may take some time, or they think that they want to like do completely in-depth analysis all the study and then they want to go hard work, not the smart work, then you can go ahead with the multiple practice cycles, go with repeated blocks, do all the stations feedbacks and go with full preparation. Less stress. I have studied so much for part 2 and now I want to relax, and then I will take up again from the November for May exam. So I am planning for May exam. This could be a thought process and this is very natural. Nothing bad about it. If somebody thinks that already I've done a lot of hard work, now I'll relax for 6 months and then I'll start from the November. It's perfectly fine, right? So this, if you want to like take it slowly, then May is a good option. But otherwise, it is very much doable in the November exam. So decision is go for November. If you are motivated, you can dedicate focus 2 to 3 hours daily and want to finish off quickly. 2 to 3 hours daily is the initial time period when we start preparing. Of course, last month, that is the October month, is going to be more extensive, right? You might need to spend 5 6 hours also, and that way you can do it easily. The last October month will be, of course, more extensive preparation will be needed. But that I think, even if you are planning for May and you start preparing from now, still before in the final days before the exam, you will be reading more because you will be revising everything. So that I think will happen in, if you are planning for May also, then also that last month extensive study is always needed. Now go for May 2026 if you are underconfident about your language communication skills. In general, how you communicate with the people or how you use your language, English particularly, or you think that there is any personal commitment which is coming up in November and you don't want to like spoil that, then it is, you can go for the May exam. So this is a very clear cut point for the decision. Now, but I want you to be beware of that what happens when you plan for the May. So you become slow. You think that, okay, I'll start studying next month, or okay, I'll read some pills and then I'll join the course or do something later. I have a lot of time. So what happens? A month after month, it starts finishing. And then finally, when you are awake, you are almost October or November. And that time when you start, you are at the same pace, more or less you are at the same pace as you are starting now. So what you can do is, even if you are planning for May, join the course or stay in the group, whatever, because it is very important. Because once you are into the group, the sessions are happening, homeworks practice is going on. So you are actively involved in the studies. So if you are planning to prepare slowly and you are going to take advantage of that repeated preparations, then that is not going to happen if you are going to stay at a separate place or just following any open group and just sitting. It's not going to work because just now 2 or 3 months will pass and you will be in the same place as you are standing now for the November. So that should not be the thing. If you are taking time for the May, then start by slowly and slowly listening to the sessions. Okay, listening to sessions, attend the sessions and see how everybody is presenting. You come to know what is the pattern. Simultaneously start speaking about the intro part, agenda part, slowly and slowly start developing that and present the homework stations. So that by the time you come for the active participation in November or December, when your next batch starts for May, then at that time you can actually present the case appropriately and get your feedback, right? So as you know, courses have all have access till pass. So again, if you join till now, at this present time also, it will continue till May. So no issues with that. Only thing is right now you will be a listener participant. So you will keep on listening, and once your the batch for the May starts after the November exam, then you will be the active participant. So that is one advantage which all of you can take, even if you are preparing for the May exam, right? So is this point till now it is clear, or any questions till now? I think the question that May and November, I think that's answered. Any queries regarding that? Anybody would like to put up any point? Okay. So I think that's clear. Now the another question which is often asked is, these are the centers for the November exam, and there are certain centers which are there for the May exam. Like if I talk about the India centers, then in the India, it is the Mumbai and the Kolkata. Mumbai and Kolkata is there in the November, and the Delhi and Chennai is in the May exam. So what happens is that sometimes the question is about which center to. Sometimes people want to decide on the exam whether to appear for November or May by looking at the centers. So that's not a right thing to do, because center does not define your passing. What defines your pass is uh, what you present in the exam, right? How do you present? How do you perform in the exam? That makes a difference. Centers never make a difference. So be very particular about it. You will, once you are into this curriculum, you will find people talking about, right? People will come and tell you that no, 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 don't book this. This is not a good center. I'm going to postpone my exam to next time because at that time these are the centers which are better centers. But this is nothing but just the fake excuses. See, always you have to concentrate on the points which are in your hand. So the point which is in your hand is to go for a good preparation, not to go and change your examiners, not to go and change the people around you in your circuit. That's not in your hands. In your hands is prepare yourself to the best. Go and present with the best of your knowledge, best of your presentation. Show that to the examiner. Nobody will fail you. Nobody can fail you for that, right? So, should the centers make a difference? No, not at all. Big no. Centers should not define whether you want to go for May or November, right? The only thing which defines is how much effort you want to put in. You want to put in extensive effort, you want to gain it early, go for November. Take some rest, read at a slower pace, will do it later, go for May. Both are okay, right? And centers should not be the point for the decision. Now, what are the reasons for the failure? This is important. Why I am talking about the failure first and then giving you the strategy? Because it is very important to learn from the mistakes of what are common mistakes made by the people. And it's not important that we make all the mistakes and then we learn. What is important is whatever mistakes people make, or already the students they have done those mistakes, we should not do those mistakes, right? We should be very thorough on those particular things. So not knowing the exam format, this is the first issue. If you are not very clear about how the exam is going to be, then that is one thing which is going to push you back. So not knowing the exam format is a biggest problem. So it's not about like we know that there are 14 stations, there are structured discussion tasks. I know this. So do I know the exam format? No. I should know how the marking is done, how examiner is going to mark me. If I know that, then I can exactly speak on what gives me marks. Because if I know that these are the 4 points which examiner wants to listen, and if I tell these 4 points, he will give you full marks. So, would you like to speak on only those 4 points and leave other 6 points, or still you want to go for other 6 points? No, everybody would like to go for those 4 points and take the marks. So knowing the exams ins and outs, that is very, very important thing to go for the right strategy. Okay, Dr. Swati, and the end we can talk about the AOT as well. Okay, fine. So that is not knowing the exam format. So proper knowledge about the exam format is very, very important. Poor station structuring, right? You know what to speak, but when you go, you speak, you are unstructured, right? So for this, practice. Practice is the key for this. So poor station structuring should not be there. Time management. This is the biggest challenge because if I tell you that yes, the patient of ectopic pregnancy needs to be managed, so in that case, you can talk about that management for 30 minutes, 40 minutes, or maybe 1 hour. But the problem is time management, right? So time management means 10 minutes. Timer is there. You have to complete your task in 10 minutes. And this is where the people lag behind. You have to pick up what are the important points which need to be covered in this 10 minutes. Because as I told you that you know everything about the management of ectopic pregnancy. But if you start telling everything, you may not be telling those points which the examiner wants to listen. You leave those points after 10 minutes, whatever you say is not counted. So now what is important is what is to be told and what are the important points which should be covered in that 10 minutes to gain the maximum marks. So on one side, it is important to know the information which I'm going to tell. On other side, it is also important that I should know how much of this I can cover in 10 minutes, right? So this time management is a very important thing. Then proper feedback is not there. Lack of feedback on the practice. Some of the people, they just sit at home, keep on talking, speaking by themselves. They are not presenting anywhere. They are not doing any active presentation. So what is happening? Nobody is correcting them, right? No mentor is correcting them. So whatever they see, they feel they are happy with it. So but when they go to exam, there is a separate examiner who is going to mark it. So you are not getting better each day. That's the biggest challenge here. So these are the reasons for the failure which we commonly encounter. So now how will overcome these challenges by our 90 days strategy? So first month should be dedicated to you should have a complete understanding of what the tasks are, right? So how to make the task, what is actually should be included in the task. So what are the basics of the communication we have to use throughout the syllabus? So your orientation, your code based stations, and the basics of communication. This all should be there in the first month. Second month, you should spend more time on the tricky questions, the tricky recalls, and try to get more and more feedback from the mentors. Now, when you get more and more feedback, you become more wiser each day because you pick up your mistakes, make them better, and you become more wiser each day. Then month 3 is mock exams and real exams rehearsal. So month 3 is basically you have to take as many mocks as possible. But it is not like you have to spend so much money to book all the mocks. No, it's not required. 7 station mock is a part of our course only. So if you are enrolling, you are already getting a 7 station mock with the course. Now, uh, what else you can do after that is, when you are studying with your study partner, right? Study partner is must in this, because you have to present a case to somebody and the other person has to check you. So study partner is very important. And you can actually have 3, 4, 5 study partners also, because see, everybody is busy. So the other person may not be free at the same time every day. So you may require sometimes different partners also. So that is why everybody should have at least 3, 4, 5 study partners. So that's very important. So what I was telling you is that you can do mock with your study partner multiple times. You don't have to go and spend money on various types of mocks. Prepare a mock for yourself, and your partner can prepare a mock for you. And this will be something very helpful for both of you, because he is creating the mock, so he is doing those 7 stations very thoroughly. When you are presenting, you are actually doing the mock practice. Similarly, next day you can make those 7 stations and your partner can present it. So try, like in this way, try doing the mocks with your study partner in the last 1 month. The more you do the random presentations with the mocks is there, the more you do this, the less is the anxiety on the exam day. Otherwise, what happens? Sometimes you are very well prepared. Sometimes you are very well prepared, but as you go to exam, you are blank. You are not able to speak. So this anxiety also you can overcome with this particular mock practice with your study partner. How many offline mocks will you have to do? See, normally offline mock one can be taken if you want to really have an experience of that roaming in the 14 stations before the exam, right? But otherwise, people can have done even without going to offline mock as well. So that's absolutely your choice, because you are already getting the experience of mock by doing the online mock in your course only, right? So you know how to present the stations in continuation. You are already doing that with your study partner also. But if you really want to have that on floor experience, then you can book one offline mock. RCOG organizations like North Zone RCOG, South Zone RCOG, they conduct mock. And that is the best one to be taken if you really want to go for the offline mock. We may go have an offline mock of our own maybe later on, but I cannot assure you right now. So in the month of August or September, when the bookings are there, the RCOG associations, they announce the mock. They are affordable also, like not very heavily priced. And there you actually get to know about from the direct RCOG people involved who in the question in the exams also. So that's the best one to take the exam. Okay. What are these stations? Basically, I'm going to talk about that. Okay. So these RCOG organizations, their mocks are the best one if you want to take the offline mock. So take it early because seats book very fast and they are quite affordable also. Okay. So this is how we are going to work in next 3 months for this. When will be the RCOG mock? You will have to check the various advertisements they are being framed. And usually we also tell when it is announced. Okay, so that's it. So we are now going to talk about.
Hello, I'm Dr. Uma.
Okay, so this is about how step-by-step preparation. As I've already told you, it's a 3-step process. First, you have to do all the basic modules. Then you will do more tricky recalls, and then we do the mock. So this is a 3-step process which we follow when we talk about the exam preparation strategy, right? So this is what she wants to tell, and this will give you an idea of how we go about through the complete syllabus.
I recently cleared my MRCOG Part 3. I'm really grateful to Dr. Bhawna ma'am and her MRCOG course. I was really very much doubtful whether I can appear for the May 2025 exam. I joined her course on the last week of December 2024, and she guided us from the first day of her sessions. Like, she conducted almost 24 live sessions, and in each session she identified our weakness and strength, and she guided us in the right direction. By the end of this 24 sessions, she made us strong in basics. And after that, after booking our entrance ticket, she conducted her recall sessions. It was a mind blowing experience. Like, I got almost 9 stations in the exam from her recalls. And she will bombard us with questions, and she will make us confident in approaching any stations in the exam. And also her mark, she teaches us how to be confident and how graceful we should be in approaching the exam. And also I want to thank her mentors, Dr. Shivani, Dr. Shreya, and Dr. Shri, because they gave us feedback in the homework stations every day, and that helped us to correct our mistakes, and that helped us to improve a lot. And also they cover all the newer talks and GTGs. So
Sorry.
I think she trained us like anything within a very short period of time. I thought whether I can appear for me in the initial period, but I was very confident in approaching the exam, and because of her, I got this degree. Thank you so much, ma'am. Let your success journey continues. Thank you.
So basically, that's how we'll start with. Course will start with, first we will do all modules like we always do for the part 2 also. Then we will move on to the more trickier recalls. So that will be recalls revision sessions. And finally, there will be the mock. So this 3-step process will take
Hello, I'm Dr.
through the complete thing. Now, what are stations, right? The question which was asked, what are stations? So there are 14 tasks. These stations are basically the tasks which you have to do. So there are 14 tasks which need to be done to complete the circuit, right? So there is a circuit. So basically 14 stations. So you can see 14 rooms are there, okay? You have to go to each room and perform the task which is assigned to you. The task is written outside, paper is pasted outside the room, and the task is written over it. And then as the buzzer rings, you go inside the room, you do whatever you are supposed to do. So like you are supposed to see this patient. There is a patient who is waiting for you. She is an infertility patient. She has got her test done, and she is here to discuss the reports with you and formulate the management plan. So now the patient is sitting inside and the task is written outside. So you have 2 minutes to prepare that task. So in those 2 minutes, you have to read that task and prepare the notes like or whatever points you want to write for yourself that this is what I'm going to talk to this patient. Then you go inside, the buzzer rings, you go inside and your 10 minutes start. So 10 minutes inside the station and 2 minutes outside. So 10 plus 2 minutes is there. So there are no preparatory stations. There will be no breaks. And let me tell you, this 14 stations going through the 14 rooms is 3 hours task. Okay. So, and this will be the fastest 3 hours of your life. I just tell you that never you would have thought of like, oh my God, 3 hours passed and I don't even come to know. This is the fastest 3 hours of your life. They will pass just in a blink. So you have to be very prepared for it because there will be no time to think about anything. See, 2 minutes you have to prepare the task. So that means you have to be spontaneously prepared. Inside in 10 minutes, you have to go and tell everything to the role player. So in that case also you need to be prepared multiple times. You have to speak so that in exam you speak at the spinal level. So these are fastest 3 hours of your life. What is the syllabus? All the modules which we have covered in the part 2, the same modules we are going to take here. And usually it is like from every module, one station comes. but it is not necessary. Sometimes, like post-operative module core surgical is very important. They may give you 5 stations, 4 stations from that only, right? And then there is overlap also, like a patient who is presenting with postpartum voiding dysfunction, right? She has a postpartum urinary retention. Now, this patient can be, you can take it as a urogyne station, or you can take it as a postpartum station, right? So there is no clear definition over it. Sometimes the stations, they are overlapping and they belong to different modules. Now, the biggest thing is your 10-minute hack, right? This 10-minute hack is very, very important because if you have to speak, you have time to speak, you can speak, keep speaking for so much time and you can cover up all the points. But when it comes to 10 minutes, then you have to be very sure. Like in part 2, I used to tell you, you have to fix answers for the EMQ so that you do not get confused when you go there. But in this case, I tell you is that you should have a fixed points, which you will talk about in the 10 minutes so that you can cover all the important points in 10 minutes. Practice is the key. Everything has to be on your spinal level. You see, you start driving a car. Initially, you are so cautious. You are sitting like straight. Your whole mind is on the steering. You are looking at the bonnet like it's not touching anywhere. So there are a lot of things you are very much focused on. You cannot think of anything else. When you are driving in the initial days. But later days, what happened? The glass of the coffee is there, music is playing, you are talking to somebody, maybe you are taking up some phone on the Bluetooth, and then you are driving, right? Still, driving is going on fine. So, what has happened? You have developed the driving on the spinal level. Similarly, when you develop these stations with practice on the spinal level, then that is the point where you keep on performing in the exam without getting any stress. So practice. Practice makes the man perfect. Be concise. Can you summarize it, right? Because as I told you, we have a limited 10 minutes, right? So everything needs to be in a very concise way. If you start explaining one thing continuously, then that may not work and that may take up all the time and your remaining points may be missed. So you need to summarize and be focused on only the important points. What more in store? So these are 5 domains. Here in your all the stations, all the tasks you do, you are marked on domains, right? How much you have covered the patient safety, communication with the patient and colleagues, patient and their relatives. How was the communication? How was the communication with colleagues? Information gathering, that is history taking. How well you have done that. Applied clinical knowledge, how well you have used it. So every domain carries 2 marks. Okay. So a station may have 3 to 4 domains usually for any particular station. So one particular room you go, you will be assessed on the domains pasted there. And what is the assessment level here? If out of 10 points, see, suppose in any particular station, you had to talk about 10 points of patient safety. So if you have talked about 8 points, 9 points, you will get the complete marks for this. We call it as passing the domain in this particular station. So you pass that domain. But if you have told 7, 8 points about out of 10, you are borderline. So in borderline, you get medium marks. That is, pass is 2, borderline is 1, and below 5 is fail. So if you are talking about out of 10 points, you are talking about 5 points or less than 5 points, then it is fail, right? So like this, your all domains will be marked. 2 number, 1 number, and 0 number. 2 is pass, 1 is borderline, and 0 is 0. So, and then there you will be marked for all the domains in that particular task, and then it is summed up. So now when you go into the room, you are doing the task, examiner is sitting there, but examiner is marking you in this. Examiner has a very structured sheet with him, right? So he knows that these patient safety points should be covered in this particular scenario. If you have covered all of those, it's very good. If you haven't, you will be marked, right? So if you have told 7, 8 out of 10, you may still pass. If you have told only 6 out of 10, then you may be borderline. But if you speak 5, you fail. So this is how very structured marking is there. So now, what about imagining yourself enjoying this? Wouldn't you love it, right? Very nice weather, car, you are going for a long drive, everything is so positive, so it's a good thing. So if what if the syllabus is like this only? Yes, so that's the purpose. We have created the syllabus like that so that you can prepare very easily for this. The question is something about 3-month strategy or 6-month strategy. Either way is fine. Again, I'm not going to give any decision onto it because you will see according to your requirements. But yes, 3-month strategy works pretty much more better than 6-month strategy. Our approach to preparation, what the station look like. 2 minutes outside the station, what actually we have to think about in those 2 minutes. Then as you enter, how you introduce yourself, how you set the stage for yourself. Then you start taking history. So information gathering, then explain the diagnosis. You have to explain what actually happened for the patient, and then draw the management plan for the patient and conclude the station. So this is how your station goes about. So first, fix your introduction, set agenda, and conclusion. These are the basic things which we need to fix, okay? Because we know we cannot afford to lose marks here. Another important thing is understand what domains mean. If I say patient safety, what is included in patient safety? If I say that communication is being marked, on what points communication is being marked? Okay, so very clear about it, how the marking pattern is going to be. So fix your introduction, set agenda and conclusion. Then according to understanding domains, you can take the history, diagnosis, management needs to be done, right? So this is how it works. Now 2 minutes outside the station are very important. Why they are important? So because it is very important to know what yourself, what you are, because many times it is mentioned that you are in the antenatal clinic today, you are in the gynae clinic today. So once you are going to the station, you have to be very specific where you are today and answer accordingly. So who you are, where you are, and to whom you are talking should be very clear. What is your task and what are the domains needs to be tested, and then according to those domains, what are the points you are going to cover up in next 2 minutes, next 10 minutes, right? So this is how you work over the 2 minutes outside station. This you can take it as like in your mind, you go through the complete station. You perform the complete station in your mind. Okay. That should happen actually in the 2 minutes period. Because once you are entering the room, then you can't think of anything. Then you just have to speak up reflexly. Oh, what happened? Sorry. I think something got clicked. Okay, so this we were talking about. So this, therefore, it is very important that we should know what exactly domains means and what is included in any particular domain. Yes, they give you paper and pen. Yes, they give you a letter pad and the pen to write outside the station. You will carry that pad into your into the room also, because you will be roaming around in the 14 rooms, right? So every time it will be the same, right? So there will be one initial copy and the pen which is given to you, and that you will carry throughout the 14 station. That's how you have to work on. Time distribution for the station, as I already mentioned, 2 minutes is outside the station. Once you enter, your 10 minutes start. Now, first thing is 1 minute introduction. You can take 1 minute to introduce yourself, then and set agenda and initial check concerns of the patient. Then starts your 3 minutes for history taking. This is very important because people take 7 minutes for history taking, 7, 8 minutes. Now, if you are taking 7 minutes in history taking, how many minutes you have for explaining the diagnosis and the management? So ideally, this should finish by 4 minutes. That is 1 plus 3, 4. Then 1 minute for diagnosis explanation. And then you come to the management options. So minimum 3 minutes should be there for the management options. Because when you start explaining the management, role player will also have the questions. She will ask you the questions. So, and you have to answer those questions because your duty is not only to just do the task, but to satisfy the patient as well. So that is why we need more time for the management. So 2 minutes outside the station, 1 minute introduction, 3 minute history taking, 1 minute explain diagnosis, 3 minute management, and 1 minute there is conclusion. So it is important that we do it like this. And why this distribution is important? Because when you are practicing, you have to focus that you are taking only this much time for this particular segment. Like if you are practicing history taking, then you are taking only this much time in the history taking. If you are trying to explain the diagnosis, how much time you are taking to explain the diagnosis. So this is very, very important to formulate that. Now, how to start from your portal, the website portal, how you start from there. So first thing is there is a understanding domains. First module is understanding domains. First go through that so that you know what are the points in any particular domain, right? So you know that what are the points in any particular domain and you strengthen it. So that is the first thing to do. After that, when you go to the modules, then in that you will find always in every module there is first expected station and the patient information leaflets. So this gives you an idea about what kind of a stations can be framed from this particular module, and there will be some information leaflets which you can use. Why information leaflets is important? Because part 3 is about telling to the patient. So when you are telling to the patient, we cannot use the exact language of guideline. We have to learn what kind of a language we can use for the patient. So for that, information leaflets are there and we try to focus on it. So expected station and patient information leaflets all are there in the first lesson of the course material. After that, there are certain video sessions. In video sessions, we have talked about like this is fertility. So if you have a male infertility scenarios, what could be the possibilities? How you can deal with these? How to take history in these stations? How to explain the semen analysis in a layman term? So this way, the videos are being created, and you have to go through those videos. Once you go through those videos, you get a idea about how to talk about this particular thing, what is important in this particular station. And all these, whatever the material is given to you, these are normally color coded, right? So the color coded means the red color, patient safety, pinkish color, that is the information gathering, green color, communication with the patient and colleagues. So that when you are learning that template or when you are reading through that, you know that why I am taking this point, which domain I am covering. So that is why you come to know about it. So first thing will be expected stations and patient information leaflet. After that, you talk about the various scenarios. Now you can use this information in when you come to the live session and you present your case. So after going to the video sessions, we have a live session. In live session, you will come and you will present your case then and there in the live session, and I'll give you the feedback for it. Understanding the scorecard is very important, right? So every past scenario has the 2 points, borderline scenario has 1 point, and fail is 0. So for every domain, you can either get 2, 1 or 0. Looking at that in any particular station where the 4 domains are tested. So 4 domains tested means maximum points can be 8. So according to that, you can calculate how well the performance has been done. So that's the scorecard. Now explain the diagnosis. Explaining diagnosis in a layman term is a challenge, right? Very, very important thing to do. Like in this case, this is the P-prom. So your baby is surrounded by the amniotic fluid or the waters contained within the membrane bag, which ruptured inside the uterus. So like this, remembering the explanation in a very remembering the explanation in a very simple way is also very, very important. Okay, so this is how you have to practice explaining the diagnosis. And after diagnosis is the clinical, applied clinical knowledge, that is the management part. Now in the management part, it is very, very important that you speak whatever is required, because this is the part which will give you the marks for applied clinical knowledge. So your applied clinical knowledge will be tested at that point where you are explaining the patient. So this is how we give you the checklist. Okay. We give you the checklist that these are the points in the patient safety, these are the points in the communication, so that even when you are practicing with the role player at home, then also you can mark each other, right? You can say that this is going to happen like this. So you can mark each other. Why I've given you borderline? Because you have not talked about these sentences. Why I've given you fail? Because you did not talk about this. So very clear picture should be there. And that's why we have put up these after every station, so that you can just, once you are revising, you know that how to work on it.
She started off with module wise classes, and her templates were just enough that you needed. They did not contain any irrelevant information, just the right amount of information that you could actually speak in those 10 minutes, because that 10 minutes time is where you have to be very specific, and every domain has to be covered in a way that you do not miss out on your marks. So that was what was very specific about Dr. Bhavna's templates. They were perfect with respect to all 5 domains that you would be marked for. She
Now, what are the various types of stations which we expect, right? So what there are basically the role player stations, where the role player is sitting inside the room and he is going to act as a patient. So role player is there and the clinical examiner is there, who is going to mark you. Clinical examiner will not talk to you in the role player stations. He will just sit with the sheet in hand. And as you are talking to the role player, he is just going to observe you and mark accordingly, right? So in those stations, there will be 3 people. You will be there, patient will be there, and examiner is there, right? But sometimes there is lay examiner as well. Now, what is lay examiner? Lay examiner is a lay person. He is a non-medical person, and he is also sitting there and observing the performance, observing your performance. So the lay examiner tells that, being a patient, how well he was satisfied by this doctor. Would he like to go again back to this doctor or not? So that is called as lay examiner stations, right? So in your lay examiner stations, you will have role player, you will have your clinical examiner, and you have your lay examiner also. So 3 people will be there in the lay examiner stations. Similarly, when it is about the junior teaching task, so in teaching task, you need only one role player will be there. Role player, that is your junior is there, and then examiner is there who is marking you. So again, the 2 people sitting there, one is role player, that is your junior, and the another is the examiner. Another task is the structure discussion task. So structure discussion is same like your Viva. You are sitting with the consultant. Consultant is asking you the questions and you are giving the answer. Now you can see this picture. This picture is the person sitting on this side. This is the candidate. And these are the people who are already sitting in the room. Now this lady, this is the role player. He is giving you the history. This is the examiner who is carrying the mark sheet and he's going to take here. But there is one more lady. So what do you think? What type of station this is? What type of a station this is? Where 4 people are there?
Role player, lay examiner, and
Lay examiner, correct. Lay examiner station, because the one person who is sitting here is the lay examiner, right? So this is how we divide the various modules. What is recommended reading? There are multiple sources: Green Top Guideline, NICE, TOG, patient information leaflets. This is very important, right? Basically, you have to go to the patient information leaflets, like what are the terminology used to explain to the patient. So what words are used, how this particular diagnosis is explained, how do we explain the management options. So patient information leaflets are the most important ones for this exam. And as I already mentioned you, that you will find the patient information leaflets in the first, that is the expected stations video. Fine. So these are generally your recommended reading. Those who are already like our part 2 students and they are continuing in the part 3, for them part 2 access will continue. So they can always go and revise their guideline from there. So you haven't read the guideline till now, no need to do it now also. Just go through the revision from the older content. What are the challenges and the common concerns? So one problem is language barrier. If you are not good at not fluent at speaking English, then you may need to spend some extra time. Ineffective communication. You talk, but your communication is not effective. So that's important. You feel inconfident, or there is an issue with the time management or patient safety. So that all things we need to know, and we have to work on these things so that we can acquire good marks. Now, this is something known as one-page notes. So one-page notes is a kind of a list. Like when you go and see a station, when you are standing outside for 2 minutes, you have to make these one-page notes, right? So basically, you will pick up what are the important points I need to do in the complete week, so that a complete station, so that we can actually write the points. And once we go inside, we know that we are talking about all this. So that becomes a one-page notes for any particular station. We will be talking about these when we will be doing the stations in the classes. Mock exams, will you give score? Yes, we give complete feedback domain wise, so that's there. So basically, with your knowledge, personality, communication, and time management, you can achieve your final degree and be happy to put up a MRCOG 5 letters beyond their name. So that's the final step. So that was about the structure, how the exam is. Now, when the course starts from 3rd, what you will be doing, first 2 days you will be spending to read the understanding domains and getting hold of it. Then you start listening to the videos. Whatever the older students have performed, that videos you will be listening to. So once you start listening to that, then you become accustomed to this new pattern of the syllabus. And then as you present, you get all the complete feedback. Fine. Any questions? Before I talk about AOT, first let any questions from this what we have discussed, or any thoughts you want to share? Okay, fine with everyone. So I'm just going to talk a bit about the AOT as you wanted. So AOT is basically your assessment of training. So you have to mention all the work you have done in the all the work which you have done from the internship till date, right? So you talk about the pre-registration and then you talk about the post-registration. So pre-registration is your usually internship period, and then post-registration, whatever you have done till now. If you have done your residency, after that you came into practice. So that complete information is written, and that form is sent to the RCOG, and then they do this, that yes, this is eligible and you can go ahead. So this is for the part 3 people only. 4 years is required. So that's any books we should keep for a reference. Although we cover almost 400 stations in our course, because you will be doing in live sessions, and then you will be doing in recall live sessions. You are doing homework in the homework group also. So usually you do not require any books, right? So usually you do not require any books. If you do these many stations, you can easily pass the exam. Okay, so this is how it's going to be. Any questions? Any questions? Okay, so all well. So now, whenever you feel ready, you can start. Already many students have joined, so we will be starting the new batch from 3rd August. So those who are doing for the November, they can directly start doing the active participation. Those who are appearing for May, they can join now, and then they will be like looking at all the sessions. They will be participating in the homework stations. Yes, you can start presenting your homeworks so that you start getting your feedbacks and improvement starts. Okay, so let's finish this session and we'll meet again in the next live session. Okay, bye bye. Take care. I hope you all find this session useful. Yes, thank
Yes,
you.
ma'am. Thank you.
Yeah, thank you. Any questions? Any questions? I think it's clear. Clear. Okay. Okay, so bye bye. If you are appearing for November, then certainly do your enrollment today and tomorrow, so that from 3rd you can start with the batch. And those for the May, you also please do that, so that you are in the group and you are not sleeping at home. And then once you wake up in November, you have forgotten all your syllabus. That's the worst thing to do. So, okay, bye bye. Take care. Thank you so much.